So one of the notes I took down for themes that I usually see is code switching stress. And so just think the way a person, changes not just the way they act, but how they speak, in any situation, right? It does move beyond language too. People change what type of clothes they wear in certain situations, their tones, their accents, right? I've had some clients tell me that they wanted to sound more straight in certain situations too. And so these are familiar scenarios people have brought up, but this is kind of more, I guess, I don't want to say technical, but kind of the terminology you'd find a lot in the literature. Um, I like to think of it whenever someone presents with me this type of topic, the cost benefits of moving between identities, right? Um, so, example, in my workplace, I work at a company for a client that has a lot of Korean expats, and I'll be very mindful of that terminology too. That's usually what they, classify the type of worker, right? And so I have a lot of issues with Korean Americans working alongside Korean expats. And so a lot of issues there too, uh, to where they're struggling with how do you say, conforming to eating lunch with the team, to staying after 5 o'clock, right? All because cultural expectations, right? And so that's going to lead to issues a little bit on the HR side. But it is that business model. And so that'd be one example.
I agree with some of like with what Michael shared because I also wrote down um like the difficulty communicating when often feeling like they are told that they speak too bluntly or that they often may feel misunderstood or misinterpreted when communicating with others, and how much of that is like grounded in our cultures. Can we show that some love, at the same time that we're also learning how to adapt, right? Some of the things that I wrote down for a lot of the issues that I see in my practice, and it might make sense to share like what modalities I practice because that's why these issues come up more often in what I do. So I provide trauma therapy. I also practice something called radically open DBT, which is a style of DBT that addresses symptoms of what we call over control, which includes um, like being rigid, rule governed, perfectionistic, overworking, a lot of like emotional suppression, and things like that. And so some of the things I feel maybe people don't often realize or think about when it comes to treating Asian or Asian American clients in mental health is the difficulty understanding um, boundaries. So especially with family members, a lot of my clients are highly anxious and feeling a lot of pressure and internal strife about how to balance their lives with their family's expectations. And so we talk about, when is it something that is like normal and natural in your culture versus when is it codependent, right? A lot of my clients arrive with undiagnosed complex PTSD, and also anxiety and ADHD. And so due to their cultural norms, they may be quick to jump in and fix other people's problems without being asked. They might put a lot of pressure on themselves to always say yes, to not ask for things, to not, question elders, for example, to feel that they don't have these choices, um, and maybe even feel a threat that they will be cut off, right, if they don't follow their family's values or wishes for them. And this can feel really traumatic for them. And, you know, I've had some Asian clients come to me telling me that they previously had non-Asian therapists who were encouraging them to confront their parents about the trauma that they had caused them. And we're like, that's really not a very culturally appropriate thing to suggest a client do in their Asian family. And so we have to really work really hard at knowing how to balance, okay, where is my boundary And when is it codependent? When is it a family value that I also want to keep? You know, how do I continue? How do I know when this is actually abusive versus a cultural factor, for example? And I think a lot of times, especially if their family tells them, hey, like we sacrificed everything to come to this country, so you have to like do X, Y, and Z things, there's all this guilt, right? There's all this guilt that they're also carrying and really trying to process like how much of that is your guilt versus someone else's. Maybe it's not yours and you're carrying it. So a lot of like these internal things that are being processed. And of course, I could go on and on. It very much will translate over into like work stressors that I hear Michael talking about. Also, maybe not realizing their racialized experience and how white supremacy shows up in those ways. Like, for example, in Korean culture, it's very still influenced by Confucianism. And how does that like interact with like Western culture, right? And then coming over here and all these different things. So those are like really complex things that I often see in my therapy.
I like to jump off of what Alexia was talking about because I work a lot with trauma as well. So I work primarily with like intergenerational trauma and like complicated family of origin dynamics. And so I see a lot of, perpetuation of abuse throughout generations, whether that's, physical, sexual, emotional, psychological. And like Alexia was saying, I think it comes down to does this actually really help the client to encourage them to confront their, perpetrators in the family, or is it something that they'd, rather deal with their own, on their own, and it's also their choice too on whether they, want to actually cut off their parents or whether that is something that or if they actually want to still maintain the connections with their family, just albeit with like a, limited contact or something like that, right? Because when we take into account like cultural values, like, we have to consider collectivism and like filial piety, and those values are still very much, present in someone's perspective and worldview. So also, speaking of things that are passed down in generations, like what I've noticed too is very much like this scarcity mindset, which makes absolute sense because we came from, countries that were torn apart from war and also poverty, third world countries. And so that mindset very much carries into American society. And sometimes it creates this kind of this narrow-mindedness and rigidity, even in environments where there is more abundance than there was in the past. So also kind of um oh my gosh, I'm sorry. Jumping off a little bit what I've said before, I think also like intercultural conflicts between, first gen or second gen or even just, Asian values and ideals versus like American values and ideals. Obviously for, first gen or immigrants, there's very much like cultural barriers, language barriers, like difficulty with adapting, right? And the struggle of trying to maintain and keep old traditions versus, having to adapt to a newer environment versus maybe second gen or at least like children of immigrants. Like there's, this burden and responsibility of having to, translate for our parents or having to help them in this new environment and also trying to figure out like, okay, where do I really belong, right? Because I feel kind of in the middle. I'm not fully Asian and I'm not fully American. So uh like what do I do, right? And so that's like what we kind of like learn to figure out in therapy is like what is like my identity, what do I really truly believe in. So yeah.
Hi, everyone. I think the first thing that came to mind for me on this is really just the first session or the first contact that I have with clients. And I would say like 95% of the time when I have an Asian American client, they're like, oh, I don't have to explain myself. Like, I don't have to expend all this energy explaining my culture and why my family operates this way and why I can't set those boundaries and confront my parents about the trauma that, I've experienced, right? So that's one of the first big things that I hear, just that relief of not having to expend all of that. And I think it's kind of what you were saying, Jenny, about allowing them to form their identity, to lean into like, what is my identity? How does that look like? Part of that is like, yeah, it's okay to have that in therapy, right? It's okay to prioritize that. It's okay to want that to be an integral focus. And I think I've had a lot of clients share that they've maybe they felt like a bit of a hierarchy with their therapists in the past of like, oh, I just have to kind of um, concede to whatever the therapist is saying. I have to kind of follow some of the guidelines. Maybe I do need to set these boundaries that don't really feel right with my intuition um, or my culture. And I think a big part of what I try to do is really empowering them with decisions. A lot of the clients that I have are very young. They're just out of college, they're in college, and they're really learning to navigate that. What does it mean for me to be an adult with my parents and kind of building this new dynamic with them? So helping them to normalize some of what they're feeling and to have agency in not only their therapy process of getting to make some of those decisions for themselves, while also, yeah, kind of navigating their own identity and kind of letting that take a spotlight once in a while. So, yeah, that's what I observed.
Thank you all so much. Just a reminder for people who just joined our Zoom that you can always turn on captions by clicking the CC button somewhere, like either at the bottom or the three dots revealing more if you would like some live transcription to follow along with. Our next question for our panelists, and Kaya will also be dropping it in the chat, is what are some barriers or challenges you've encountered when providing services specifically to the Asian or Asian American community? I know you've touched on it a little bit, but now we're really honing in on like what makes this difficult.
I'm going to switch up the order a little bit and go first this time. So I think two things that I have noticed kind of fall under the same umbrella is a lot of education about the therapy process. I have a lot of clients who come in and they're like, 2 sessions, right? Like I'm going to be feeling better. I'm going to hit those goals. And so a lot of it is helping them understand, what does that therapy timeline look like? What is maybe the more initial phase? What comes after that? What does a long-term goal look like? A short-term goal look like? So a lot of it is educating them on that process. Another piece under that, I think, is the diagnosis element. So I do accept insurance, and thanks to our healthcare system, I do have to make a diagnosis so they can use their insurance. And I have a lot of clients who are a little taken aback or uncomfortable with that. Like they want to use their insurance, but they don't want a diagnosis. They don't want some kind of record or some marker of something's not right with my mental health. So part of it is kind of walking them through it, really explaining and being very transparent with, what does the diagnosis mean? Why is that the diagnosis? Are you comfortable with even using it? Do we need to like skip that piece of it and maybe go out of network? And just really giving them a lot of explanation so that they can make that decision and again, have that agency as I talked about. So yeah, explaining the therapy process and explaining the initial diagnosis as well. So those are the two kind of challenges I notice.
I agree with that, like education around understanding the mental health process. And so what I can add to what Sambavi shared is getting them to feel their feelings, and that still feeling purposeful, a lot of my Asian and Asian American clients, they just want me to tell them the answer. And there's like the pressure is kind of transferred onto me to fix things when that's not my role and that's not how it works, right? And so, of course, as it being an Asian American myself, I also will have that like countertransference feeling of like, okay, this feels familiar, like in my own family of how like I have to take on this responsibility. And if I don't give them their money's worth or like whatever it is, then I've failed, right? And I have to myself like remind myself that this is many of our mindsets about like how to approach life. How to approach relationships to be aware of. So a lot of my clients will be just way too goal oriented for this reason. And so when I try to coach them on like feeling their feelings and not being so attached to an outcome at this time, I'm usually confronted with like, well, what's the point? Like, why would I do that? And it's just going to make me feel worse. Right. And so really trying to explain to them that process and why that is important. I think a lot of times they are surprised to find out that they're allowed to feel things, and that they're allowed to feel conflict, right? And to want to say no, or, I think a lot of shame, a lot of deep anger too, that gets in the way the anger really shows up when I might have a client who doesn't want to engage in the process because it requires them to make a change when they want me to fix it. And this is like a manifestation of that anger that's been there for a really long time. When they are burnt out, they're overwhelmed, they've been having to like carry the burden for their family and have been carrying all this pressure for so long, right? And those are the cases that can be tough where I have to practice being aware of the bigger picture that this is like a step on their journey and that they will hear this again and this will continue in that fashion until they come around to it, right?
Yeah, I think that there's still definitely a mental health stigma because especially in Asian communities, like saving face is still a really, really big thing. And I find that clients, even when they do come in for therapy, like Alexia was saying, they often want the results and they don't have as much faith in the process. And it becomes kind of like they just want like a quick resolution and like they feel shame if like it doesn't work as like quickly as they want it to. So it becomes sort of this balance of trusting the process and also giving them like practical tools so that they can, feel a little bit like they're progressing in some way. I also find that like they can become sort of defensive in session, especially if you're bringing up stuff that's never being talked about in the family or things that feel shame, they often, people become defensive when like they feel shame about like maybe something they've done or something that they've experienced like in their past. So I personally would like to work more with Asian American adolescents, but it is difficult to work in particular with that population because parents often, especially immigrant, like first generation parents, often have, already that mental health stigma and they don't want to really bring their uh, their child to therapy if, because that would mean that they would lose face if that happens. So yeah, things that I've noticed.
I just had a general one. So one of the challenges just for working with future colleagues, be prepared for the differences of how people advocate, right? Different approaches. So some future colleagues may advocate in a different way than you, right? So this would be a good time to kind of reflect on that, define what allyship look like for you, how much emotional labor you're going to choose to invest, right? Pick your battles. And don't forget to stay focused on the goal, which is the welfare of the client. Um, I like to think like the bigger the ship, the bigger the monster. Learn how to be diplomatic, especially if you're going to navigate through those bigger systems.
Thank you so much, everyone. Your answers are very, very, very exciting. Our last question for the panelists section before we go into student insights and then Q&A is what are some things you're still learning about or areas you're growing in regarding your work as a mental health professional?
I guess I'll go first. Yeah, I think for me, it's managing my own countertransference. So, my own lived experiences, like I'm a second generation Chinese American. And so, yes, I grew up here. I actually was born in Austin. And so I very much grew up with, feeling like, okay, like I'm caught in between cultures, right? My parents are first generation Chinese immigrant, like Hong Kong influences, Fujian influences. And so they very much are kind of set in their ways. And so that kind of conflicts against, my values. I have some American values as well as some Asian ones, but that can lead to a lot of conflict. And so sometimes when I see kind of that dynamic in session, it makes me want to, maybe root for the child or the second generation. And so that's something I have to keep in mind because the client is a different person. And so I have to consider their values and their perspectives. So yeah.
I'm still learning how to compromise, navigating with clients, their understandings and explorations of social media content while advocating for the field. Right? So kind of either debunking or uh, really combing through Insta therapy, I call it, when some of my clients really rely heavily on Instagram or social media, especially with folks who either don't have insurance, don't have access, or are a little bit younger. trying to better and learn for their mental health. And so it's been tough, especially when people bring up about the breakup recovery process in 2024, like how long I should get back into something if I dated this person for a year, and things like very odd relationship formulas and calculations about age gap relationships. X divided by 2 at 7. That's the acceptable minimum age to date a person younger than you and stuff like that. And so, and gendered expectations about like, who's supposed to initiate, text back within a certain window. And so, yeah, it's quite a journey. So definitely still learning in that area. Very relevant, I think.
I really related with the countertransference piece that Jenny mentioned. I know that I feel that I learn from my clients a lot of times as well. So like, when I have a client that's complaining about their spouse who isn't Asian, not being able to like read their mind because they come from a collectivist culture and their spouse doesn't, I'm like, holy cow, I have done that to my husband who is also not Asian. I'm like, I did that, I get that. And so that has been really interesting. I think right now the challenge I'm experiencing is so majority of my practice, my clients are BIPOC, and most of them are Asian or some other immigrant. And I've more recently started seeing couples as clients. And I have been finding that a lot of the approaches for couples therapy do not translate very well to couples who are immigrant, especially Asian. And so that has been a really enlightening process where I'm like pulling on all the different knowledge and research that I have and kind of customizing these approaches to these families, and that has been really interesting.
I just want to say real quick, Michael, I can't tell you the number of TikToks I've watched together with a client in session, so I'm with you on that one. The thing that I have noticed that I think I find a bit challenging, but also that I'm curious to learn more about is I specialize in working with a lot of students who have ADHD, and I've lately been getting a lot more Asian American clients who have been, like getting diagnosed later in life and wanting to explore that. And something that I've been hearing a lot lately that I've kind of have my own hypotheses about, but I want to learn more about is clients sharing everything was fine when I was in high school. Everything was fine when I was a kid, when I was at home. And now that I'm out on my own, everything's an issue. Everything has changed. And I'm so curious about the impact of collectivist culture on like what makes ADHD easier, what makes having that support help my clients be so successful. And I know personally I have ADHD, and I've noticed that too when I'm around my family. Suddenly all those executive skills that are so hard are just like, it's just running so smoothly. So that's something that I've been marinating on a lot lately, and I'm very curious to continue to research and talk to other folks who have experienced this to continue to understand more about that.
Thank you, everyone. So our next section is going to invite students to give a little insight on their experiences to kind of bridge the gap. So our first question, very open-ended, is do you feel like there is a disconnect between the average person and mental health as a field or mental health professionals?
I can also jump in and get the ball rolling if that's okay. I am a student. My name is Kea. I go to UT Austin. And kind of regarding that disconnect between the average person and mental health professionals, I think there can be sometimes like a disconnect in the sense of like not necessarily fear, but like a disconnect in like jargon or, not feeling completely understood as a young person, and things like that that can definitely like make it kind of hard to, reach out or to like connect. And yeah, that's just a little way I can start the discussion if any other students want to jump in.
Hi, my name is Nari. I'm currently a high school student. And at least for me, I think in my personal experience, what's been most difficult for me is kind of understanding my diagnoses. I've been struggling with mental health for a few years now, but I recently got a formal diagnosis a few weeks ago. And I think for me, what's been the most challenging is I think addressing it in a healthy way because I know a lot of Gen Z and teenagers like to deal with difficult situations with humor. And although that's good in moderation, I think that sometimes I can overuse it to where it's unhealthy. And yeah, just finding the balance between getting that diagnosis and making sure I'm getting the help I need and also not letting it define me as a person.
I'm also curious to know some of the, well, I saw Michael unmute, but I'm curious to know what are some of the barriers aside from matching with someone, aside from paying for therapy and insurance.
I just wanted to respond back with Nari and kind of like the overall question. Do you feel there's a disconnect between the average person and mental health professional? Um, in grad school, one of the most basic things that they taught us was counseling is not for everyone, right? And what's cool about, my position as a consultant without having to, or not allowed to do any clinical therapeutic interventions anymore like I used to, is I get to work with people really at the beginning stage of the entire ecosystem of the map, right? To where I say, hey, do you feel like you're ready to work with a therapist? Have you ever worked with one? And do you want one that, can diagnose you? Or do you want one that doesn't believe in, pathology, right? That believes in seeing you as a whole, right? And so I could see, how that question's formed. This is kind of why some people, uh, when they do begin to select someone to speak with, someone to build that relation with. Sometimes some folks don't choose LPC. Sometimes they go with a social worker that practices therapy. Sometimes they choose a therapist that doesn't diagnose, right? So just wanted to put that on the table.
Yeah, I can jump in with a little bit about like some of the barriers that like I personally have faced with, looking for mental health care and stuff. I think finding one thing that we've kind of talked about is like finding a provider that fits. Like I've had to see a lot of different providers and having to like re-explain like your whole life story um over and over again can sometimes be like really exhausting to get, back on the same page with people. And then I also just feel like like the initial jump to seeking care is really difficult. Especially like I'm someone who struggles with depression and like really low motivation at times. So like picking up the phone or, sending that email and being like, find that effort that it takes to find someone that, and hope that it's going to work out and hope that like you're going to have a good rapport with them, that can be really difficult. And that, sometimes it feels like, or it used to feel this way, kind of before I got like more involved in like the field. Like I was like, oh my gosh, like what do all these letters mean? What, like, do I need ACT? Do I need DBT? And like, that, can get very overwhelming as an average person looking at all that and trying to figure out how to navigate it, what works best for me, especially as someone who struggles with just motivation in general, that can feel like an overwhelming process.
Just because a lot of the audience is being very silent, I thought maybe I would add like my experience as a client. Um, Previous to becoming a therapist, and I'm also a client still to this day. Um, and I don't know how many people may share in this feeling like a deterrent, but it has been for me. I don't know if it feels that deep for others or whatever, but um, I once went to a therapist office and it was like an intake session. It was my first time going there. And as soon as I walked in, they had like this 3 foot tall gold Buddha statue like inside the house. There's like a house that they turned into a therapy practice. And so I go sit in the waiting room, I'm looking around, and they have like a decapitated Buddha head on the shelf. Like a lot of Westerners will have that as decor. They had banners with Lu Tsao quotes on the wall. They had end tables that were Thai elephants, like ceramic Thai elephants. And so I go into the intake, and I was a therapist already that was also seeking therapy when I went into this intake. And so I had a little bit more like courage to confront this and be like, is the owner of this practice Asian? And they were like, no. And I was like, oh, because there's like a lot of, I essentially was like a fetishization of our Asian cultures, and kind of like explain like what that was like for me walking in and not knowing them. And I don't think that that's a really common perspective that is given, because a lot of times we are taught to like ignore those things. We're taught to like stay quiet, to not pay attention to our own feelings when there's discomfort, and to just defer to like the dominant space, right? And so I'm basically resisting this when I'm explaining this. And this therapist's response to me was like, wild, because like all of our trauma therapies are based on like these very things that you're talking about. I was like, I know it's a big problem, you know? And so this is a thing, right? That a lot of Western mental health modalities, evidence-based modalities, like all these things have taken from Asian cultures, their religions and their philosophies, and turned it into this like big moneymaker. And now, you know, many of the items from our cultures are home decor without a whole lot of significance when it comes to singing bowls, when it comes to like all these different things. And I really pause about this because Asians also tend to be a population that's underserved in the mental health field at the same time that the Western mental health field is just inundated with our cultures, right? And I think that's weird, right? Maybe that's too deep, but that's just how I feel.
We actually have a lot of questions in the queue. So if there are, I mean, if you have a burning experience you'd like to share as a person seeking services or as a student, please let it be known now before we head over to our Q&A. Okay, our first question, very voted up, asks, do you think therapy can benefit the older generation, i.e. first generation or parents' generation, even if they have a stigma against it, or they don't think it will work?
Therapy doesn't work if someone isn't bought into it or willing to do it, number one. And whatever they may need or benefit from in whatever phase of life that they're in doesn't have to look like therapy. I think that telling stories is really powerful, like having space to tell their story. So maybe we're not doing like an evidence-based, like super processy, like dig it all up kind of thing. But you know, I have a client whose father is in the end stages of his life and had previously been pretty private about his thoughts and feelings, but more recently has been starting to apologize for things, reminisce about the past, express regrets. And for those of us who study, you know, in our field, we know that this is according to Erickson, like the phase, like the end stage of life that is a developmental phase. We don't stop developing just because we got through adolescence. We continue to going through developmental phases for the rest of our life. And my client, of course, didn't understand this and thought, oh, my dad needs therapy so that he doesn't suffer, you know? And I had to kind of like educate that this is actually really normal and we want to support this. So it doesn't have to be therapy to benefit someone, even though it may feel therapeutic.
100% fully support Elexia. At the final stages of practicum internship, right? They have us. They had us in our program uh, practice counseling with the community, right? And several of my professors, they had us do it without using any therapeutic intervention. We have to practice basic skills. Can you be in a room? Can you hold the space with someone and give basic empathy? Can you model to them that you are a person that is safe, right? Can be trusted with something really powerful they're about to share, right? And so I think it is possible. Um, I mean, what in some journal articles they talk about some of the Asian communities bring up somatic symptoms whenever they talk to medical doctors, right? Somatic symptoms first, as opposed to mental health symptoms, because it's maybe more accepted, right? And so, even though we're not supposed to do any type of a therapy with friends or family, a code of ethics, I promise. I tried this out with my dad a little bit. I was like, hey, because one day he was super quiet, and I'm like, hey, are you kind of feeling something right here? Are you feeling something more right here? Or is it more in your stomach? Right? Then all of a sudden he's like, oh, actually, you know what? It's, more right here. Actually, maybe the back of my head. I'm like, well, it doesn't sound like a headache. So I kind of know. I knew something was up. And I knew he didn't need an aspirin. Right? And so then later he's like, oh, your mom, there she goes again. And then all of a sudden, 30 minutes later, right? And so I think it is very possible, right? Um, if we reframe it as just like the basic skills of connection, right? Connecting with someone and them finally having the opportunity to do that and to experience that, especially if they've never experienced that in their life, especially about certain topics too. But that's a different story.
Yeah, I think it depends on how open they are to the mental health in general and to the concept of therapy. So, I mean, if you have if someone from the older generation who is like, okay, like let's try this, right? It's like it might actually work because like they're bought into the idea, right? Versus if you're talking to someone who's very rigid, very set in their ways, like they're going to become very defensive in the process. That said, I think psychoeducation can be very helpful, especially when, say that I'm working with like an AAPI adolescent and I'm, talking to their parent. That is a place where I can provide a lot of psychoeducation and maybe do like, mini family therapy sessions so that we can improve the communication and understanding between, family members.
Disclaimer though, there's a lot of unlearning when it comes to bringing that conversation upon older generations respectfully, right? And so just be very mindful if you're going to go that route. A lot of battles, pick your battles really wisely, right? So very sensitive buttons that might be pressed.
Very true. I've had personal experiences with that with my parents. So.
We have a follow-up question in the chat regarding providing therapy for an older client whose values are similar to your own family's that may be triggering for you, and how do you confront your own feelings within your profession?
I think yes, I've definitely felt that countertransference. I think fortunately with the role that I'm in, I've also got to see a lot of success stories, and I think that has given me a lot of hope. And so when I hear some of those moments of, oh, that sounds like my dad, or oh, that sounds like so and so's uncle, or whatever the case is, I think it always helps me to anchor back to that hope of just because X situation turns out one way doesn't mean this is the same. And kind of leaning into that hope. And I think that helps me kind of come back to the center and come back to this person, their story, their situation. So I think hope is kind of like a guiding light for me from what I've experienced thus far.
I don't know how helpful I can be with this, but I thought I could provide an option for those who are wanting to be therapists. So I will not treat older Asian women. It is too close to like, I guess I just have like a lot of unresolved stuff with my own mother. And I just know that I'm just not ready for that. And so I pay attention to that and I honor myself, right? And I have that boundary. Um, I don't know that I've had very many older Asian men try to do therapy, so I don't know about that. But yeah, one time I surprised an employer when I was working with a group practice because I think that they hired me to be able to provide therapy for diverse clients. And when I said I don't do older Asian women, they were like, "What?" I felt like they were going like, "Well, why did I hire you?" So they're very confused by that. But I did have a client who it was about my age, and I'm not a mom, but this client is a mom, and I did notice that their parenting style felt a lot like my mom's parenting style. And I noticed that countertransference. And I don't know if everyone here knows what countertransference is. I think sometimes we're taught to be like, no, that can't happen, refer out, but you don't have to. You can use that in the therapy and out yourself to them. Maybe you're like resonating with their experience or relating. Maybe you're sharing, like using self-disclosure to give an example of your experience to help process together. And as long as like you're being mindful and that's the benefit of the client, and not about you needing to be heard or whatever it is. And I have found those moments to be really connecting and really helped expand. Like it created a lot of like expansion in the way the client was able to view their situation. To maybe get a little bit of insight about what it's like for their child, because I was that child, you know, and yeah, I think it could be helpful. And I still don't think that I can work with older Asian women, but I was surprised to find that I was like kind of given like um that opportunity.
We have a pretty well, to me, I've seen this come up a lot in my life as well as my communities. But the question is, how do you explain the importance of medication to first generation parents who prefer holistic approaches like, oh, are you depressed? Have you tried going outside? Or like exercise?
Well, I guess I'll start. I do work with a lot of teens, so I do hear this often, like the pushback of, but like, why medication? Like, they're already in therapy. Like, shouldn't that be fixing everything? And I think part of it is speaking that in their own language, right? So, like, medication is part of a greater holistic approach, right? Like, medication is one part of it. Let's also focus on therapy. Let's also focus on other wellness practices. Like, there's this big scope to look at. Let's also honor, like, Eastern wellness practices, right? Those can be part of the picture as well, right? So I think kind of inviting them in as opposed to like, no, this is the only option, like it's just medication. I think also giving them agency and helping them to kind of dip their toe into the water. So it's maybe not having a conversation that's like, yeah, like go see the psychiatrist, let's get the medication, let's keep it moving. it's like, hey, let's like explore what psychiatrist maybe you might feel comfortable talking to. Is there a certain type of provider that you feel safer with? Let's just like have an initial chat like that. No one's going to make you take medications or give your kid medications from that first appointment. Like really breaking all of those pieces down, and kind of just letting them slowly dip their toe into the water until they maybe do feel more comfortable. And obviously, it's not, foolproof. Sometimes medication just does not feel right for a parent. And I think if they're the parent, you have to respect their decisions. But I think there's a lot that can be done as far as opening up that world to them, and kind of just meeting them where they're at and really educating them on what it really means to be on medication and why it's important for things like depression, ADHD, things like that.
I've actually encountered the opposite experience more often. Like, people like to throw medication at a problem instead of going to therapy. But that said, like I liked what Sambavi was saying about these are all tools that we can use to help clients and to help ourselves, right? And so medication is very good for stabilizing symptoms, for getting you to a place where like therapy can really help you, and then therapy can kind of carry you like the rest of the way. So kind of like framing it, and these are the things we can do, these are options that y'all can try. So
I've only so the last time that I worked with an adolescent was the last time because of the parents. I was like, I am not working with adolescents anymore. The only way that I will do that is on a case by case basis, and I set the bar high. Like I'm basically like, in order for me to work with your kid, you as parents need to be in therapy and in parent coaching. So I like have those requirements in order for them to work with me. And the last time was the last time, and it was an Asian family. Their kid had OCD, also autism, also ADHD. And I mean, one of the parents was just like really intrusive in the therapeutic process, put a lot of pressure on me. Like I already explained how like this is like my Achilles heel in a way, just kind of like it's not working, we think we need to quit, or whatever it is. And I think medication was a part of that profile of just not really giving it a chance, feeling like it's not working, feeling like their kid is not trying hard enough, all those things. Now, I don't believe I was very successful in being able to get through to that family. And I think that doesn't mean that I did anything wrong. I think what I've learned as a therapist is that all of it is a part of their journey, and they might fizzle with you, but they will always be back. It might not be back with you, but they will always be back. And this is a part of their journey, and you're one part of that. Now, I can speak a lot to clients who aren't necessarily adolescents, or a family situation who need medication. As a DBT therapist, as is most of my clients. And I guess I want to kind of normalize that most people do not immediately adopt the medication or like the referral out to a psychiatrist. Most people do not. I think that we might have this because we already carry this anticipation that there is the stigma, there is like the culture, there is like our parents' responses, that we may feel even more just kind of like bracing for that being the response. But this is basically everyone. Everyone, when they're like, we think medication would help you, with this, or like, no, let me try it on my own. I'm kind of scared. I don't know what that will do to me. All that kind of stuff. This is everybody. And so, I just kind of want to like normalize that response, I guess, is what I'm saying.
For those that are wanting to learn about the field, especially still in school, right? This is a fantastic question to look into case management, right? If all else fails, case management, account management, sales experience, this is the time to collect that and earn that now. Local mental health authorities, LMHAs, right? That's going to come up too. Question asks, can you help? How do you explain the importance of medication when many first-gen parents prefer holistic approaches? There are folks, even in Williamson County, right? I was case manager at Bluebonnet Trails, right? Which is kind of like the sister cousin north of Integral Care in Austin, right? So I had to work with nurse practitioners and doctors, right? And so we would work together. And that's part of it, right? If they wanted help, if they wanted service, these are folks without insurance, right? For their issues with housing, finding a job, mental health, right? They would have to go to their appointments, right? And so with their appointments, some of them would need to take their medication, right? And so this is kind of like as a case manager, you get to see both sides where you can lead with that behavioral health approach, and you'll see the doctors, the nurse practitioners lead with the medication approach. And this is kind of where you educate and teach them, hey, I'm just letting you know, you're showing your nurse that your mood meds have been having some improvements, right? As you get older, as you grow up, right? You have the choice to either continue to be consistent with this, and you can kind of see what happens when you are, versus if you want to choose without. And we've had those months, and we worked together when you went without. So that's where those folks can definitely come in too. And I feel like through your program, especially internship, site practicum, where you may have a high chance of landing at one of these agencies to earn hours, that's probably where you're going to experience seeing that. So good segue there.
We also have a question on advice for students interested in the mental health field, but don't know anyone working in the field or don't know how to get there. I also know some people really struggle with joining a practice after graduation or finding someone to supervise them.
I truly believe that working in a psych hospital is a really important experience to have as a therapist. It probably isn't where you want to stay like forever, but you will learn a lot. Um, and it will give you a really great like short and long view of someone's journey. And a lot of times hospitals are basically like almost always hiring because people kind of use that as like their environment for being a new therapist where they have a team, they are exposed to doctors and like severe illnesses and like how to handle suicidality, like all and like what are the medications. They just kind of learn a lot when you're at a hospital. So that can feel like a supportive environment, even though it's also a stressful one. And they almost always are hiring, right? Sometimes they provide in-house supervision, but not always. There is I think like I think that there's a spreadsheet somewhere on the Austin Therapists of Color Facebook group of supervisors of color. And then asking around to people who they used for supervision. There's varying rates. You know, people charge different things that have different structures. I think it's important for you to know like what kinds of skills or population you want to work with, as well as someone that's going to help you pass your exam. And so I think there's kind of like a managing expectations things. There aren't always a lot of great supervisors that will help you prepare for the exam and attend to the population that you want to work with, even though what you think you want to work with might change, your idea of that might change over time. And so I think a lot of people, this happened to me. I went in being like, I need to get a lot out of this supervision because I'm paying a lot of money for it. And then it was so difficult, actually, I'll just be honest, to find someone that checked off all those boxes. I was like, okay, I just want to meet my hours so I can take my exam and move on. You know, I was reducing my expectations, but I still got a lot out of supervision and out of that experience. So yeah, psych hospitals, asking around, anyone's help, like welcome to reach out to me if you have questions about how to enter the field. And usually in your, I think like your last semester or maybe your second to last semester of like your program, you're usually given an assignment to interview a few providers in your community. So that's also an opportunity for you to ask them questions. That's usually like a homework that you're given.
Yeah, I would say like don't be afraid to reach out and cold email people. That's what I always did to, learn more about the field. And I took kind of the long way around to being a therapist because I was So I have an MD, so I had wanted to be a psychiatrist, and because that's basically the combination of, medication with therapy, right? A lot of stuff happened basically. Ended up changing careers. Now I'm an LPC associate, so I'm much happier in my current career. But I think learning more about like the different professions, like what it takes to be like a psychiatrist or like a psychiatric nurse practitioner versus like a social worker versus like a licensed professional counselor, like learning the differences between these, like and figuring out, okay, like what would I actually like about each of these, and what are the differences, so that, maybe in social work I would do more of like providing resources, right? Versus like, or do I actually want to, focus on the counseling itself? So figuring out those differences, I think, is really important. So
I would also say, like, try a lot of different things, talk to a lot of different people, like everyone's already said, make mistakes, explore everything. I've done a lot of different jobs, and everything that I've done, I still kind of use those things that I've learned in those past jobs at present day, even if they sound very different from what I'm doing now. So I would say, like anything, it might seem like it's not your end goal, it's not the final destination you want to be at, but just try it, experiment, see what's out there. It's all going to be so useful to you down the line.
And if we didn't say psych hospitals enough, I'm going to say the clinicians that I have seen struggle the most are the ones who didn't get their psych hospital experience because they already knew that they wanted to go in private practice. So they went straight for that. And a lot of times the clients that come from those therapists and come see me are the ones where their therapist overreacted about their suicidality, or didn't really explain certain things, or, whatever it might be. So, this might not be everyone. I just know that I have heard this story like often enough that I just truly believe that getting that experience in a psych hospital is really helpful, instead of being like, I know I want to go to private practice, let me just go straight there.
Also wanted to shout out Michael's comments, which are to find the internship coordinators now, because they hold the list of placement sites and you get to preview where you might intern, and to just cold connect people on LinkedIn with folks at different stages, so early, mid, end, and then do a SWOT analysis for each stage and reflect on that. And I think we have time for one more question. I am going to ask that our panelists think about what's one accessible thing that we all could do to better our mental health after we leave this event.
I love this question. We love accessibility. My answer would be to play, just like incorporate play into your life. Go blow some bubbles, go listen to your favorite song from childhood, go on a swing at a playground, like just go have fun, incorporate play into your life. Your brain will thank you.
I'm a big advocate on unplugging and being off social media. And so I know that could be quite hard for some people, since, certain aspects of their life, like work and stuff like that, they need it to, market and stuff like that. Um, if you can do that for a day, a week, a month, right? Just begin to observe what you're doing in your extra time. Maybe write and reflect who you end up mainly are talking to or spending time with. You're going to find out a whole lot. Used to do that a lot in the 90s. So you might enjoy it. So yeah, unplugging.
I was trying to give like a heart to Sambavi's answer because I totally agree with that. But then it gave like heart balloons, was maybe too intense of a response to that. But I also really agree with Michael, unplugging, engaging in play. At first, I was going to say be more open and vulnerable, but the key word was accessible, right? Maybe we're not there yet. I would say feel your feelings, especially the uncomfortable ones. I think that we compulsively avoid feeling discomfort, and then we wonder, why am I so anxious all the time? Like when you notice an uncomfortable emotion or any discomfort, see if you can just sit with it for like 5 minutes, sit on your hands, do nothing, and find out that the world doesn't end, that you can feel that emotion as opposed to pushing it down, avoiding it, distracting yourself all the time, all those things.
In line with what everyone else has been saying, I think self-care. I think this past week has been hard for a lot of people, and there's a lot of tension in the air. So I think just taking the time to be like, okay, like I'm feeling this way, like let me do something to soothe myself, whether that's taking time to read a book or go hang out with friends, or go hang out with your cat or something like that. So.
Thank you so much, everyone, for participating, for attending, for taking the time out of your evening. We have some resources for you to leave with in case you didn't already know about them. This is not an exhaustive list. There's many out there. Just some local ones include Integral Care, NAMI Central Texas, Inclusive Therapists. ACHI has our therapist directory with many Asian Texans serving mental health professionals, including counselors, psychiatrists, so people who can prescribe medicine, people who just do counseling, and the Asian Mental Health Collective. And we also want to give a big, huge thank you to our panelists for spending time with us and giving really great expertise. I want to ask them so many more things. And they have agreed to share their contact info if you have follow-up questions, to connect, and including their websites. Thank you all so much for attending today. We're really grateful.